Did you know that nearly half of all seniors over the age of 65 are taking at least 5 prescription medications daily? And here's the kicker. Many of these medications may be doing more harm than good. Shocking, right? Imagine this. You're sitting in your doctor's office, trusting their expertise as they hand you a prescription. You take it home, follow their instructions to the letter, and yet, months later, you start feeling worse instead of better. Fatigue, dizziness, memory lapses. It's like your body is betraying you. But what if I told you that some of these symptoms might not be caused by aging or illness, but by the very pills you're taking to feel better? This isn't just speculation. It's a growing concern among health experts. Many seniors unknowingly fall into the trap of taking medications that could actually worsen their health. Why? Because doctors often don't have the time, or sometimes even the awareness, to fully explain the risks associated with certain drugs. And let's face it, when you're handed a prescription, how often do you question it? Most of us assume our doctors know best. But what if they're missing something critical? In this video, we're going to uncover the truth about 5 common medications that seniors should think twice about, and why they be sabotaging your health. This isn't just another doom and gloom medical lecture. It's a wake-up call. By the end of this, you'll have actionable steps to protect yourself and make smarter decisions about your health. So, if you're ready to take control of your well-being, stick around. Your future self will thank you. Before we dive deeper into this eye-opening topic, I want to ask you something important. Have you ever felt unsure about a medication you were prescribed? Or maybe you've noticed strange side effects but didn't know where to turn? Comment where you are watching us from and your experience. Below, if you've been in this situation, it's more common than you think, and you're definitely not alone. And while you're at it, hit that like button if you're loving this content so far. It helps this message reach more people who need to hear it. If you haven't already, subscribe to this channel because we're all about empowering you with life-changing health insights you can trust. Trust me, you won't want to miss what's coming up next. We're just getting started. Now, let's get back to the heart of the matter. Are you ready to discover which medications might be quietly harming your health? Keep watching, because knowledge is power, and today, we're putting that power in your hands. Let's talk about something that's happening right now, in homes, just like yours. Picture this. An older adult takes a pill for blood pressure, another for cholesterol, one for joint pain, and perhaps a couple more for sleep or anxiety. On the surface, this seems routine, right? After all, managing multiple health conditions is part of aging. But here's the problem. Many seniors are caught in a cycle of overmedication, and they don't even realize it. Overmedication, also known as polypharmacy, is when a person takes more medications than necessary or combines drugs in ways that lead to harmful interactions. According to studies, nearly 40% of seniors are prescribed medications that aren't appropriate for their age group. These drugs can cause side effects that mimic other health problems, leading to even more prescriptions, a vicious cycle. For instance, a senior might experience dizziness from one medication, prompting their doctor to prescribe another drug to treat the dizziness. Suddenly, they're juggling multiple pills without addressing the root cause of their symptoms. But why does this happen? Part of the issue lies in fragmented healthcare systems. Many seniors see multiple specialists, cardiologists, rheumatologists, neurologists, who each prescribe medications without always knowing what the others have recommended. While these doctors are experts in their fields, they may not always consider how their prescriptions interact with one another or whether they're truly necessary. Additionally, pharmaceutical companies often market drugs aggressively, sometimes downplaying risks to push sales. As a result, seniors end up on medications that may not align with their unique needs. The consequences of overmedication can be devastating. Common side effects include confusion, falls, fatigue, and even cognitive decline. In fact, certain medications have been linked to an increased risk of dementia in older adults. And let's not forget the financial toll. Unnecessary prescriptions can drain savings and leave seniors struggling to afford essentials. What makes this issue even more alarming is that many seniors, and even their caregivers, aren't aware of the dangers. They trust their doctors implicitly and assume every prescribed medication is safe. But here's the hard truth. Not all medications are created equal, and some come with hidden risks that outweigh their benefits, especially for older adults. So, what's the solution? First, education is key. Seniors and their families need to become informed advocates for their health. Ask questions like, is this medication absolutely necessary? Or are there safer alternatives? Second, regular medication reviews with a pharmacist or primary care provider can help identify potential issues before they escalate. Lastly, lifestyle changes like diet, exercise, and stress management can often reduce the need for certain medications altogether. The bottom line is this: overmedication doesn't have to be an inevitable part of aging. With awareness and proactive steps, you can protect yourself from unnecessary harm. Stay tuned, because next, we're diving into the first of 5 medications that seniors should approach with caution, and why doctors might not be telling you everything you need to know. The first medication is Benzodiazepines. Let's start with a group of medications that many seniors rely on to manage anxiety or insomnia. Benzodiazepines. You might know them by brand names like Xanax, Valium, or Ativan. While they're effective at calming nerves or helping you sleep, they come with serious risks for older adults. Benzodiazepines slow down brain activity, which is why they work so well for relaxation. But in seniors, this effect can lead to confusion, memory problems, and even an increased risk of falls. Studies show that long-term use of benzodiazepines is linked to cognitive decline and a higher likelihood of developing dementia. Here's the kicker. Doctors may prescribe these medications without fully explaining the risks, especially if they're focused on providing quick relief. But there are safer alternatives, like cognitive behavioral therapy, CBT, for anxiety or insomnia, which don't carry the same risks of dependency or side effects. So, what can you do? If you're currently taking a benzodiazepine, don't stop cold turkey. That can be dangerous. Instead, talk to your doctor about tapering off gradually while exploring non-drug options. The second medication is proton pump inhibitors, PPIs. Next up, we have proton pump inhibitors, PPIs, commonly used to treat acid reflux, heartburn, and ulcers. You've probably heard of Prilosec, Nexium, or Prevacid. While they're effective at reducing stomach acid, long-term use can wreak havoc on your body. For seniors, one of the biggest concerns is nutrient deficiencies. PPIs can interfere with the absorption of key nutrients like calcium, magnesium, and vitamin B12, essential for bone health, nerve function, and energy levels. Over time, this can increase the risk of osteoporosis, fractures, and even neurological issues. Another alarming risk: studies suggest that prolonged PPI use may increase the risk of kidney damage and even dementia. Yet, many seniors stay on these medications for years because they don't realize there are safer ways to manage acid reflux. What's the alternative? Start by addressing lifestyle factors that contribute to acid reflux, like eating smaller meals, avoiding trigger foods like caffeine and spicy dishes, and elevating the head of your bed. For persistent symptoms, H2 blockers like Zantac or Pepcid are often safer options. The third medication is anticholinergic drugs. Now let's talk about a class of medications that many seniors take without realizing the hidden dangers. Anticholinergic drugs. Anticholinergic drugs. These include medications for allergies, like Benadryl, overactive bladder, like Ditropan, and even some antidepressants, like Elavil. Anticholinergics work by blocking acetylcholine, a neurotransmitter involved in memory and muscle control. While this can help with certain conditions, it also increases the risk of cognitive impairment, confusion, and even delirium in older adults. Long-term use has been associated with a staggering 50% higher risk of dementia. The problem? Many anticholinergic drugs are available over the counter, so seniors may not even think twice before using them regularly. Others are prescribed without a clear discussion of their risks. If you're taking an anticholinergic drug, ask your doctor if there's a safer alternative. For example, non-sedating antihistamines like Claritin or Allegra are better choices for allergies. For bladder issues, pelvic floor exercises or medications with fewer cognitive side effects may be more appropriate. The fourth medication is non-steroidal anti-inflammatory drugs, NSAIDs. Chronic pain is a common issue among seniors, and non-steroidal anti-inflammatory drugs, NSAIDs like Ibuprofen, Advil, and Naproxen, Aleve, are go-to solutions. While they're great for short-term relief, long-term use can be disastrous for older adults. NSAIDs can irritate the stomach lining, increasing the risk of ulcers and gastrointestinal bleeding, a serious concern for seniors who may already have weakened digestive systems. They can also harm the kidneys, raise blood pressure, and even increase the risk of heart attacks or strokes. Here's the reality. Many seniors pop NSAIDs daily without realizing the cumulative damage they're causing. Instead of relying on these drugs, consider safer pain management strategies. Physical therapy, acupuncture, and topical treatments like capsaicin cream can provide relief without the systemic risks. For inflammation, omega-3 fatty acids found in fish oil supplements can be a natural anti-inflammatory option. The fifth medication is certain diabetes medication. Finally, let's discuss a category of medications that's particularly concerning for seniors managing diabetes: sulfonylureas and insulin. While these drugs are effective at lowering blood sugar, they can sometimes work too well, leading to dangerously low blood sugar levels. Hypoglycemia. Hypoglycemia is no joke. It can cause dizziness, confusion, fainting, and even seizures. For seniors, these episodes can lead to falls, fractures, and other serious injuries. Yet, many doctors continue prescribing sulfonylureas like glyburide or glipizide without considering newer, safer alternatives. Newer diabetes medications, like GLP-1 receptor agonists, for example, Ozempic, or SGLT2 inhibitors, for example, Farxiga, offer better blood sugar control with fewer risks. Additionally, lifestyle changes like adopting a low glycemic diet, staying active, and monitoring blood sugar closely can reduce the need for high-risk medications. At this point, you might be wondering, why aren't doctors more upfront about these risks? The truth is, many healthcare providers are juggling heavy patient loads and may not have the time to thoroughly explain every medication's potential downsides. Others may not be fully aware of the latest research on how certain drugs affect seniors specifically. That's why it's so important to advocate for yourself. Ask questions, seek second opinions, and always weigh the benefits against the risks. Remember, your health is your responsibility, and you deserve to know the full picture. Now that you know about these 5 medications and their potential risks, let's talk about how you can take action to protect yourself. Here's the good news. Small changes can lead to big improvements in your health. Start by reviewing your current medications. Write them down and bring the list to your next doctor's appointment. Ask specific questions. Is this medication still necessary? Are there safer alternatives? What are the long-term risks? Don't hesitate to involve your pharmacist. They're medication experts, and can provide valuable insights. Next, explore lifestyle changes that can reduce your reliance on medications. For example, if you're taking PPIs for acid reflux, try cutting out trigger foods and eating smaller meals. If you're on NSAIDs for chronic pain, consider physical therapy or acupuncture. Small adjustments can add up to significant results. Remember, progress doesn't happen overnight. Celebrate every step you take toward better health. Whether it's asking one extra question during your appointment or swapping out processed snacks for whole foods, each choice you make brings you closer to a healthier, happier life. Stay tuned, because up next, we're wrapping this journey with an empowering message about the ripple effect of your choices and how they can inspire lasting change. We've covered a lot of ground today, from uncovering the hidden dangers of overmedication to arming you with actionable steps to protect your health. But let's bring it back to the heart of the matter. Your choices, no matter how small, have the power to create profound change. Every question you ask your doctor, every medication review you schedule, and every healthy habit you adopt adds up to a life filled with more vitality, independence, and joy. Think about it. When you take control of your health, you're not just investing in yourself. You're paving the way for a brighter future. You're showing the world that aging is not about limitations, it's about possibilities. So, what's your biggest takeaway from today's conversation? Was it the importance of asking questions? The value of regular medication reviews? Or maybe the transformative power of lifestyle changes? Share your thoughts in the comments. I'd love to hear what resonated most with you. And don't forget to subscribe to this channel. Together, we're building a community focused on empowerment, education, and wellness. Hit that notification bell so you never miss an update, because your health journey doesn't stop here. There's always more to learn, more to explore, and more ways to thrive. Thank you for joining me today. Remember, you hold the keys to your health. Take that first step, celebrate every win, and trust in your ability to create a life you love. Until next time, stay strong, stay curious, and keep shining.